With the many different types of dizziness that exist, it's important to be able to tell the difference between dizziness that's coming from the inner ear system versus those that are coming from the eyes versus those that may be coming from the neck or even the brain itself. Ideally, a patient will have already gone to an ENT or an audiologist and gotten vestibular lab testing like you see over here called caloric testing, where basically they're going to put cold air or cold water or hot water into the ears. And they're going to watch the eyes for certain patterns of nystagmus that can show up if someone has a vestibular weakness. Typically, they're also going to have the goggles on, do video nystomography, where they're going to watch their eyes and looking for nystagmus related to positional vertigo, characteristic of BPPV. If they haven't done that test, then we will run a VNG test ourselves and we'll look at the patient's eye movements, especially looking for signs of spontaneous nystagmus, which is characteristic of vestibular weakness, and we'll also do things like the Dix-Hallpike test to assess for BPPV. Then we might put their vision under some stress and we might show them backgrounds like this called an optokinetic stimulation and see if the patient has a visual sensitivity to these types of fast moving visual backgrounds, and we'll look at their balance when they're looking at that type of stimulation versus when their eyes are just in a relaxed position, and seeing if these types of stimulation activities either make them feel motion sick, make them feel nauseous, or increase their sway, which might be one of the hallmark signs of something like a vestibular migraine. And then when we're looking at a neck, we'll use this device called Neck Care, which allows us to test multiple aspects of cervical spine function, like range of motion, joint position error, and cervical motor control, because any deficits. The goal of all this, of course, is to figure out what is the most likely cause of the person's dizziness symptoms. So that way, when we do all these tests, we can know what direction we could push the patient in terms of what types of treatments or rehab situations, or we could refer the patient outward if we think that what we do here isn't necessarily the right fit. Because many clinics have a one-solution-fits-all type of an approach, which fails quite a bit of patients. And the most important thing that we care about is making sure that the patient gets to where they need to get the best result, even if that best result might not come from us.